Hey guys, Dr. Ray Marquez here, your local chiropractor at Back Pain Relief Center down in Murrells Inlet. This is our live Your Back Pain Consultant channel. Again, so as we're talking through here, if I stumble a little bit, I guess we're doing it live. There's nothing we can do, but I'm going to give you all this information, straight from my heart and straight from the things that I know about neck and back pain. Today, I wanted to talk to you a little bit about personal injury cases or car accidents, and kind of what goes on with them and how you get injured and why it's important to seek some treatment. So number one, when you get in an accident, another car hits yours and your car absorbs energy. And by absorbing your energy, your car kind of crumbles up a little bit. The problem is that the rest of that force goes through and hits you. And hopefully you had your seatbelt on and we're in a seated position, but that force goes through and impacts you. And that impact starts a bunch of trouble, primarily in the neck, because that neck goes forward and back. So I think they call it a acceleration deceleration injury, meaning it moved forward awfully quick and then it stopped. And what that does is it injures the muscles, or they may call it a soft tissue injury. Now, we all know it can be a lot worse than that, and I guess we're kind of talking about your regular, if I can even say regular, just your typical rear end collision, and hopefully there's nothing broken, there's nothing cut, you didn't pass out, it's not your major accidents, and that's a whole other boat. But when you get in these rear end collisions or front end collisions, I guess, you can get a soft tissue injury, and it doesn't take that much force to do it. I was in an accident, I don't know, maybe 6 months ago. My wife and I were just stopped at a light, and I think it was in traffic over on 707, so everyone that lives out there knows how busy they can get. And the girl just tapped us, and it, scratched up my bumper a little bit, but even a little bit of a tap, I can feel that pressure in my neck. So it doesn't take a whole lot for there to be problems. So back to that soft tissue injury. The soft tissue injury, we have a bunch of muscles that hold our spine together, and they are responsible for us moving our head and our back and things like that. And there's a bunch of fibers, and those fibers kind of interlace, and they kind of look like that in a way, almost like spindles. And what happens is, they contract back and forth normally, but when you take that impact, we get these little micro tears in them. So all these micro tears inside the muscles, and they're just like cutting yourself. Sorry, I think I had a call there. But anyway, if you cut yourself on top of your hand, it's got to heal. Same thing with micro tears in the muscles. When they get torn, they have to heal. And the way they heal is by laying down collagen or like a fibrous tissue to make them whole again, or to stop them from being torn apart. Now, in and of itself, that's not a big problem. So say these muscles up here, these upper trapezius muscles or these neck muscles have all these micro tears in them. Those micro tears will heal, and it's going to take 6 to 8 weeks for it to heal, just like anything else. And it can make the muscles really tight. Now, here's a problem. What if that tight muscle is connected to our neck or to our back? It can make that joint dysfunction. And if it hits it hard enough, or it pulls on it hard enough, it can even make you have a disc problem or a nerve problem. And that's where we get into these bigger problems when left untreated. So typical soreness, you may be going, well, I'm okay, it was just a little bit of an accident, I'm a little sore. Well, that little bit of soreness can lead into a lot of problems down the road. So it's really, really important to get checked out and make sure that you don't have that soft tissue injury and it doesn't turn into a big problem down the road. We start up quite a few patients in our office, almost all of them referred by other people. A portion of those that weren't directly from a car accident were in a car accident 5 or 10 years ago and never got proper treatment, and now they're here in the office and we have all these issues to deal with. So you may be saying, hey, I need to go, or I'm sorry, hey, maybe I went to the ER. I went to the ER and they said, oh, I was okay. Well, the problem with the emergency room, and I don't even want to say it's a problem, their job is to make sure you didn't break anything, you're not bleeding, and you're not going to die. Okay, and then they're going to refer you to the right specialist if they think there's an issue. Unless there's one of those, they'll diagnose a soft tissue injury. Maybe they give you some muscle relaxers, and then they kind of send you on your way and say you're okay. But I've been doing this a long time, and there's plenty of doctors out there that have also been doing it, and we all know that you're not okay, and it can really snowball into a big deal. Another issue there is sometimes that pain from that soft tissue injury takes a couple weeks, maybe even a month for you to start feeling that pain. So again, the ER is great, very important to go, but you want to make sure that you get checked out by someone who specializes in these accidents and can make sure that you're going to recover properly. when you do get that soft tissue injury, one of the reasons why we want you to come in and get checked out right away is so we can make sure that those injuries heal correctly. And they can heal correctly by getting the correct amount of therapy and the right doctor seeing you. This way we point you in the right direction. The next thing there is sometimes it takes a team of doctors to get you better. What do I mean by that? Well, therapy alone or chiropractic care alone may not be enough to get you to heal correctly. So with all of my patients that come in to see me and I do the chiropractic end of it or the chiropractic therapy end of it, we send them out to our medical doctor and we get a full evaluation and make sure that they get checked out, get any appropriate medication that they may need, and make sure there's no underlying issues that maybe we didn't see. The next thing we may need an orthopedic. So if we think there's a shoulder problem or knee problem or hip problem, something that I don't specialize in, we want to get you to the right doctor to get you to heal up correctly. So one of the things we do here at Back Pain Relief Center is we make sure that all of our patients that have been in these accidents get that team of doctors to check them out to make sure everything's okay. So again, that's a little bit about personal injury. That is a small part of our practice. If you've been in an accident or know someone that's been in an accident and you're not sure about it, please message me, leave a comment about this video below, and I'll make sure I'll get right back to you and point you in the right direction. Okay, so this is our Tuesday, your back pain consultant video, and I'll be back on Friday to give another one. Hope all is well, and I'll talk to you soon. Bye-bye.